Assalamu alaikum and welcome to the show Mindful Matters on Radio Al Ansar at 90.4 FM in Durban and 105.6 FM in Pietermaritzburg. A show that promises to provide an hour of inspiration, information and motivation with me, your host, Nazia Iram Osman. This will be a pre-recorded show, so unfortunately, we will not be able to take your WhatsApp messages. But if you have any queries or feedbacks, you can email me at kznpsychologist@gmail.com. Today's topic is on perinatal distress, how to avoid it and ensure a stress-free pregnancy and birth. Perinatal distress, or PND, is an umbrella term used to describe symptoms of depression, anxiety, and stress that women may experience from conception to 1 year following birth. This also includes loss and subsequent grief in the pregnancy caused by issues such as miscarriages, stillbirths, terminations, and infant born with disabilities. 50% of cases in terms of postnatal depression already have symptoms present before the woman can even go to give birth. There are many factors that may predispose women to perinatal distress, including physiological, psychological, social, and cultural factors. Physiologically, the body is going through many changes to support another life. Fluctuation in hormones to prepare the body for the time is usually associated with ambivalence, frequent mood changes, varying from anxiety, fatigue, exhaustion, sleepiness, depressive reactions to, guess what, excitement. Psychologically, at particular risk are women who have had previous history of depression, trauma, or anxiety. Especially those on psychotropic medication usually have to stop these during the gestation period. Socially, relationship issues, particularly domestic violence, having a limited support network, limited resources, and financial or major life stresses just make things worse. Culturally, the role of women, the duties expected of them, the pressure of being the perfect mother and having the perfect pregnancy also exacerbates issues. Symptoms of perinatal distress vary depending on the woman's circumstances and history. They may include low motivation or enjoyment in life, excessive feelings of guilt, low mood, excessive worrying about baby's health, or just a general anxiety or feeling of dread over everything, and social isolation. Perinatal distress may also impact on the mother's ability to respond to her baby, which can then impact on the relationship and cause attachment issues. Some mums may struggle to express their concern or may feel unable to voice them due to stigma, guilt, or shame. It has been my experience that encouraging women to increase their support network and implementing self-care strategies such as providing information and referrals to support groups can help with the reduction of symptoms. To tell us more about this is Sumayya Muhammad of Mother's Intuition. Welcome, Sumayya.
Jazakallah for having me.
It's such a pleasure, and Sumayya is such an interesting person to speak to. So, Sumayya, I can't pronounce that word. I struggle with pronunciation. What do you do again? What is it called?
I'm a doula.
A doula. Okay, is that simple?
Yes.
Okay. So tell us a little bit of what a doula does.
So there's three folds in which a doula can assist. We assist moms prenatally with antenatal classes by providing information that allows them to make informed choices. Mm-hmm. We provide exercise classes for pregnant moms as well as massage. So we can do pregnancy massage for a mom prenatally after the first trimester. Mm-hmm. We also attend births, so we can assist mom and dad during this process and stay for an hour after birth to initiate breastfeeding. Okay. So that the hour after birth is what we refer to as the golden hour, and it's extremely important that we get some Skintoskin in and then we initiate breastfeeding in that hour.
Okay,
right?
So contact and attachment starts straight away.
Definitely. Right. And then postnatally, we can include massages for mom and baby, lactation consults. In my case, we do hour care, baby baths, birth debriefing, which is very, very important if a mom finds that she didn't get the birth that she had planned. And birth seldomly goes as we plan. It changes every second. Okay, and then we also, in my practice, I do emotional and trauma release. So we work subconsciously to release all of these emotions and if we've had birth trauma from the birth itself. So obviously, all doulas do different things, but in my practice, these are just some of the things that we offer.
Okay. So I'm curious now, how would you release the emotions of trauma? Is there a specific method or?
Okay, so I did something called Afia healing training, and then we do eye movement therapy, where we work subconsciously to help release all of these emotions.
Okay. And you said you help the mom make informed choices.
Yes.
What are these choices?
So, for example, a lot of moms don't know what options they have when it comes to birth. You can have an option to basically walk around during labor, so you have gravity assisting you. Okay, a lot of moms think that they have to be lying down in bed with the fetal monitor attached to them to monitor baby's heart rate and to monitor contractions. Those are very important, don't get me wrong, but we don't need to be there indefinitely. Basically, we go between half an hour to 45 minutes on the trace machine to get those measurements and contractions timed. But beyond that, gravity is there to assist you.
Right.
So that's just one of the examples. Some moms won't know what delayed cord clamping is. So we give them information about delayed cord clamping, which basically we allow baby to be born first and then the placenta to be born. And once that cord stops pulsating, then to cut the cord so that baby's blood reserves and platelets all go back to baby. Whereas if it's cut immediately after birth, it's all left behind in the placenta. Obviously, now this doesn't apply to emergencies. If baby needs to be delivered immediately and baby needs to be taken to the neonatal ICU, for example, then they might not always be an option for delayed cord clamping. But we basically provide you with up-to-date information relating to birth.
Wow, I didn't realize there were so many options.
Yes.
And I think when a woman is pregnant, especially going to give birth, you're not your most rational. You probably want to get out of there, do what
Yes.
needs to be done. So you don't realize
Exactly.
that there are these things that, and you said the golden hour,
Yes.
within that space of time.
Yes, and you just mentioned it now. You can't vocalize anything during labor. So another important thing that we cover are birth plans.
Right.
So we basically put everything that you want out of a birth into your birth plan so that you can pass it on to the midwife on duty and your doctor. Because when you're 6 or 7 centimeters dilated, you are not able to vocalize what you want.
Well, you can vocalize, but you'll scream,
You
right?
scream and you might not. You might be unsure of what it is that you actually want because you are not in the right frame of mind.
So if you're screaming epi and your just your birth
Yes.
plan says no,
So
which way does that go
okay,
then?
So I always tell moms you can't go hard and fast on your birth plan, right? Moms who go hard and fast on their birth plans, their births usually go completely opposite, right? And so if at that point a mom wants an epidural, whereas she said I didn't want an epidural, if she wants it and she vocalizes that she wants it, you're going to give her the epidural because she's never, for a first-time mom, she's never been in that situation before to say, well, I don't want the epidural, right? And then now suddenly you're in a situation where you cannot bear the pain. You're going to give her the epidural.
Okay.
But certain things like skin to skin, if she wants skin to skin after birth, I'm very glad to see that a lot of the hospitals are now starting to do this as routine where they are doing skin to skin immediately after birth. But it's fairly something new here in KZN. Previously, we had to, ask for it and then we would get it done.
I would think that's the most natural, though, that
It
they put the
is.
baby on.
Yes.
You're talking about that. You put the baby
Yes.
onto the mum's chest
It's
straight
skin to
away,
skin.
right?
Yeah. But in the last maybe year or two, it has become more common because the breastfeeding regulations have come into play from the government where they want you to exclusively breastfeed your baby, initiate breastfeeding.
Right.
But before that, it wasn't such a big deal.
Right. And someone who's been through, just say, C-section, I know
Yes.
normally they take the mum away and take the baby,
Yes.
to let the mum rest.
Yes.
So are you saying even in that case, if your birth plan says, no, I want skin to skin,
Yes.
they'll bring the baby to you?
So as doulas, depending on at which hospital and which doctor you're working with, and if they allow the doula into theatre. So I've been into theatre where we've done skin to skin and we've latched baby on in theatre. Okay.
Right.
Certain hospitals won't allow you in. My last baby was an emergency cesarean birth. So it was on my birth plan that I wanted skin to skin. And even though the hospital didn't offer it, it was against their protocol. They still did it because I had requested it and I wasn't going to budge on that.
That sounds like the thought in my head is, wow, you're bringing back the power to the mums.
Of
Because
course.
I remember back in the day, you were, shipped off to this hospital so many hours beforehand, and they had the dreaded enema. I don't want to have kids again, but if I do, there'd be no enema involved. But you didn't feel like you had
Power.
a choice. You didn't
Yes.
have that voice. You didn't have the power.
Definitely.
And, while we were chatting outside, I just quickly added this question because I think this is so relevant to every woman that's had a child.
Yes.
And you were talking about there are certain exercises to do that takes your tummy in. And you
Yes.
said there is no golden period.
Yes.
So, woman, there's good news. And I am going to go to Sumayya for this. What is, you said diastasis recti. Recti.
Diastasis
Recti,
recti is
okay.
basically muscle separation on the abdominals.
Okay.
So the pressure inside when you are pregnant, a lot of women end up with this muscle separating. And there are certain exercises that are completely contraindicated to getting that muscle back together.
So this that little pouch that everybody has,
The mummy
is that it?
Well, with an assessment we can confirm, but usually if you do have that pouch, then it is a diastasis recti. We can feel the separation during an assessment, which I do. And then I give you specific exercises depending on what type of separation you have, whether you have the connective tissue beneath the muscle that's also loose, because we have to tighten from inside. So it's very important to connect with your core. Okay. There's a lot of diaphragmatic breathing that needs to be done to connect with your core and your pelvic floor.
Oh, wow.
Right,
So you're saying just breathing can do this?
Breathing is one of the very, very important parts of the program, but there are specific exercises that I give you. So it's over 4 weeks.
Okay.
It's over 4 weeks, or 4 sessions. I prefer actually having 2 weeks in between each appointment so you have adequate time to do these exercises.
So it's not just doing the exercises with you, it's also exercising in between.
Yes. So you come to me for your consult and your exercise, and you continue that until the next appointment.
Right. And I remember someone telling me, and maybe you can tell me if this is true, that if you pull your breath in, that amount that your tummy goes in is as far with exercise as you could get the tummy to pull in. Is that true?
You see, you could do that. It's not completely 100% correct, right? Because when you're breathing diaphragmatically, with your inhale breath, your tummy comes out. That's how we're actually supposed to be breathing. We're supposed to be engaging our diaphragm.
So when you breathe in, your tummy comes out.
And when you breathe out, your tummy goes in, right? So if you watch babies that are just born, that's the way they breathe, right? But because of our constant time limits and our stress, we're not breathing correctly. We're breathing the opposite way, and then that becomes normal. Right. But by just breathing diaphragmatically, we're engaging the pelvic floor muscles.
Okay.
Right.
Because then I'm just thinking with my anxious patients, I always tell them, imagine like there's a balloon in your tummy, and you're breathing in all the good things, and you're breathing out all the...
Yes.
Yeah, so...
Okay, so we're supposed to be breathing that way, but then we've become so concerned about how we look when we're breathing. It was like, now you're breathing out and your tummy is... you're breathing in and your tummy is going out. Now you're looking like you're having a fatter tummy, right? And holding your tummy in as well all the time is not good for you, because you're increasing pressure within your muscles inside.
Okay, so all these... What about those corsets or those things that they tie up after birth? The old ladies will take a scarf and take it...
That is actually quite the best way. So I do bengkung belly binding, which is a Malaysian art of belly binding post-birth.
Okay.
It's very comfortable and it's awesome because you wear this throughout the day and then you take it out basically to shower. Okay. But it's very comfortable. But you should not be... A lot of women are exercising with waist trainers and belts and all of these things. But that's contraindicated to your muscles, because your muscles are meant to be moving and now you're restricting them. So what are you actually doing?
Confusing the body almost.
Yes, you are. And you're not allowing the muscle to move as it's supposed to, because you're restricting it.
Sure. That's interesting stuff. So, who needs a doula? I'm saying who needs a doula? who are the majority of your clients?
Okay, so all moms, especially first-time moms and dads, need a doula. Okay, modern medicine.
Can I pause you?
Yes.
Why do dad needs doula? Why do they need it?
Imagine this as a first-time mom. This is all happening to you. You don't know what to expect. You don't know what to do. It's the first time he's having a kid as well. And he doesn't know what to do. Men don't know how to react when they see their wives in a vulnerable position, because you're extremely vulnerable during labor and birth, and they don't know how to react to that. Right. And we find some dads wanting to leave the room, and then that's negatively impacting on the mom because she wants her husband to be there. Right. So it's for dads as well. We prepare dads as well for labor and birth. So my antenatal classes are actually one-on-one. I don't do group settings in a hurry.
Oh, so you do a couple?
I do a couple classes. So I come to you and we do classes together so dads understand what's going on.
And they could probably be more sympathetic or empathetic towards their partner.
Yes, absolutely, right? And the thing is, modern medicine is realizing the importance of having females supporting females during this transition into motherhood. Okay. So moms become more confident with their babies. They adjust better to motherhood, and they have lower rates of postpartum depression because they are supported in all aspects of this journey by a doula who is trained for this specific journey.
Okay, because I think I read somewhere a while ago that having someone in the room with you, someone that cares for you, also people use less painkillers.
Yes, endorphins are being released.
Right,
natural painkillers to the body.
Yeah, no, but I mean someone there caring for you also adds such support. Otherwise, you reach out for it in the wrong form.
Yes, and by just being there, by supporting that mom during that process, is allowing endorphins to be released in her body.
Right. And so what are the universal challenges you see in women that are pregnant?
Okay. I'd say that would be an access of correct information when it comes to pregnancy, birth, and life beyond it. Are you getting information that's allowing you to make an informed choice? Or are you going for a class which routinely says something like, well, you need an injection on your thigh to deliver the placenta? That's the difference between a normal antenatal class or a doula or midwife-led.
So are you telling me you don't need that injection?
No, you don't.
I feel so cheated. This is so bad.
Well, if you follow the natural process of baby being born, baby still being attached to the cord because you're having delayed cord clamping, baby going straight onto the breast, the suction of the baby causes a contraction on the uterus which expels the placenta quite safely.
Okay, so the body knows what it needs to do.
The body knows exactly what it needs to do. Now, obviously, if you're talking about a placenta creta, for example, where the placenta is stuck onto the wall of the womb, then that's a completely different situation. But if there are no complications and there's no bleeding or hemorrhaging and stuff, you can do that quite safely. I actually remember during my first birth, my doctor said to me, okay, cough, after I had delivered my daughter. And I didn't have any injection. And just the cough itself allowed the placenta to be born.
Oh, wow.
Yeah.
That's interesting. Sure. So I think you sound like a more natural alternative to the normal.
Yeah. Well, basically, a doula is being in the doula profession itself is being part of a holistic environment.
Okay, a holistic, caring, natural sort of environment. And I think that's the way it should be.
Going back to basics now, because everybody is realizing the effects of all of the interventions.
Yeah, because I don't know about others, but just the look of a hospital is enough to frighten me.
Yes, it does. And, from a psychological perspective, you'll understand what happens to the body when it's afraid. Right?
Because it's a very sterile, clinical environment.
Clinical.
Then the moment you go in there, you lose your control.
Yes. Right.
Yeah.
And I remember as a child just going to the doctor. I didn't despise going to the doctor himself, but I hated sitting in that specific waiting room and smelling all of the surgical smells that specific doctor had. And I eventually asked my mom to please change my doctor because I couldn't handle the smell of the surgical. I don't know what it was, whether it was the surgical spirits or what it was, but it smelled very medical.
Right.
And we find also that moms in that environment go into fight or flight. Right.
The stress response would be on.
Stress response, dilation stops, contraction stops. So we go back to a primal example. If you find, just say a deer giving birth in the woods, right? As soon as she sees some sort of threat or an animal, like just say a lion, for example,
she's not going to give birth.
She's not going to give birth. Her body automatically stops the process. Right? Same thing. If you feel as a woman, you're in labor, you feel disrespected, you feel uninformed, you feel that there's no informed consent, the lights, the smells, we're just wearing that backless gown. It
so
changes
uncomfortable.
it changes the entire flow of birth. So a lot of moms choose to labor at home while speaking to their doctors. Right.
So there is safety. Safety is ensured
always. Right.
Okay.
We always tell moms, for example, if your water breaks and it's green, you need to get to the hospital because that's showing that there's meconium in the fluids, which is quite dangerous. Right. So if a mom feels like she can labor at home, we leave her to labor at home for as long as she feels comfortable. And then you have moms who want to go to hospital immediately. That's totally fine as well. You have to work with what you're comfortable with, and you always have to trust your gut and your instinct. I have clients calling me, should I go to the hospital or should I stay at home? I cannot answer that for you because you have to trust your mother's intuition.
Yeah. And that's your name.
Oh, yes.
And I just think I have relatives in Johannesburg who have an in-between option where they don't want to do it at home. They don't want to go to hospital. They have almost these hotel setups where they have like these tubs.
Genesis is amazing.
I think it is,
Genesis,
where they have the option of even the water birth.
Yes.
Yeah. And
we so lacking that in KZN. We need a birthing home.
Something where you have the option of both. Just in case.
Yes.
Yeah.
So... But fortunately, we do have some good doctors who give you what we say a home birth away from home.
Okay.
There are a few.
So there are setups like that?
Well, look, Crompton Hospital has a jacuzzi in one of the birthing suites.
Okay.
Right? One of the most amazing doctors is at Crompton.
Okay.
And he goes above and beyond for his clients.
Okay. Right.
Yeah.
So I'm sure, look, we have to generalize, but I'm sure most doctors want what's best for their clients. But it also has to be a fit what the client was, their value system.
Yes.
Does it resonate with the doctor? And are they open-minded? Things like that.
So it also falls down to choosing your doctor.
Right.
Are you choosing your doctor because your sister went to this doctor or your sister-in-law went to this doctor, or are you making
he's just popular for
or
the
he's
time.
popular, or your husband wants you to go to a female because he's comfortable with a female. But I mean,
It has
is
to
he
do a lot
deliver-
with your
Yeah,
comfort.
Is he delivering the baby?
I don't know, if we had those choices, life would be very different. And, I'm trying to bring it back to the topic.
Yes.
Perinatal distress.
Yes.
I'm wondering whether you see lots of women who present as, beyond the baby blues or beyond that, just the normal. Pregnancy is a time of extreme change. It can
Right.
be, you can be excited, but I'm sure most women would be pretty much afraid.
Yes.
Anxiety comes on, sadness comes on, your body is changing.
Yeah.
Do you see a lot of women that are distressed?
I do. I
Right.
find most of these women that end up stressing is because they don't know what to expect. Unforeseen, So attending an antenatal class that ticks off all your boxes is key. What are you looking for in an antenatal class, right?
Okay.
We also find that massage is very important to relax you. Just touch, right?
Okay.
Touch relaxes you. Most importantly, if you're having any emotional issues, so maybe you can bring this in from a psych perspective, but I find that any emotional issues cause a problem. It's imperative that you see a psychologist as it affects your birth in so many ways. If you're being physically abused,
Right.
right,
Yeah.
it's going to affect your birth. If you're unhappy in the environment that you're living, it's going to impact your birth. Okay? So in that sense, you need to have some sort of debriefing, some sort of therapy to deal with all of these issues.
Do you need that extra support?
We do need it. And also I'd like to add that seeing a chiropractor is very important as well. A chiropractor ensures that your pelvis is in an optimum position for birth because your center of gravity changes in pregnancy, right? So that's the mechanical part of birth.
Okay, but when you say chiropractor, I always get afraid of chiropractors.
Oh,
They look
they're
like the word
amazing.
manipulate. They say they manipulate your body. I'm like, no, I don't appreciate that. I mean, is it safe?
It's 100% safe, right? So there are different chiropractors that do different things. So I have a specific chiropractor that I refer my ladies to, and she's female, and she's so good during pregnancy and for the little ones after birth.
Okay.
It's important that you see a chiropractor, even if you're having a repeat C-section, for example, it's important to see a chiropractor because we have moms that are having lower back pain. Okay, so your round ligament in itself is stretched out.
Okay.
Right, it's holding everything up. So you will have round ligament pain. But also, your center of gravity is changing, so your muscles are pulling in different ways. And then you have muscles compensating for the other, and then that is presenting with what we call iliosacral pain, so the joint on your pelvis and your hip. Or you have lower back pain. And the chiropractor just basically puts everything so calmly into place.
Okay, so with gentle massage,
Very gentle.
nothing jarring.
Yeah, like I see the chiropractor when I'm pregnant. I see them after. I take my babies to them because there's so much of benefit because your spine stores so much of emotion in itself. Your pelvis stores so much of emotion.
Right.
So we need to ensure that the neurological system has no blockages and no stagnation. Besides speaking from a mechanical point of view, as the pelvis needing to be where it needs to be for the baby to actually fit in comfortably without causing an issue, right? We have emotions stored all over in your spine, and that we know that the spine is pushing impulses throughout the body.
Right. And you said something important, that if there's violence, if there's already a relationship that is not supportive,
Yes.
things don't usually get better in pregnancy because your hormones are all over, your body is changing. So, when I hear people say, look, I'm not in a good relationship, but a baby would solve all of this. And I think, oh
no.
Lord, please don't do this to this child, because to put that pressure
Yeah.
on a child and on yourself, because pregnancy, I think, would highlight everything so much more.
It does. Besides trying to sort a situation that's not going to be sorted out with a baby, you're passing on all of these emotions to your baby.
Because the cortisol levels
Yes.
the cortisol that's released in your body if you are stressed would be affecting baby.
And the limbic imprint comes in greatly. That's like a whole other topic on its
So
own.
the limbic system is the part of the brain that deals with emotions. So here if you're already affected, you're going to
Yes.
affect that child's emotional regulation.
Because that's all growing at that point.
So you have a baby that comes out screaming, crying for every little thing.
Yes,
and you
overstimulated.
Go, overstimulated.
And then you
right.
see their personalities as they grow up. It's already imprinted. It's very hard, but possible to break.
Yeah.
But it's difficult.
So usually a calm mom
Yes.
would probably be indicative of a calm baby.
100%.
Okay. And in terms of loved ones, how can they support someone, especially if they see that they're struggling through the pregnancy? Or just say, I mean, look, some anxiety is normal, but just say
Yes.
we have someone who all of a sudden is getting panicky, thinking the worst, things like that. How can loved ones support them?
Okay.
How can they be there for them?
Right. So I'd say you have to identify what are they stressing about. Okay.
Right.
So like we said, if they have circumstances that are not changing, they have abuse, for example, see a psychologist. Okay. You have to work through the situation. If you are stressing because you don't know what to expect, attend an antenatal class that ticks all of your boxes.
Okay, so practically, take practical steps.
You have to. You have to be proactive in this
Right.
process. I always say, with birth, you can't go with the flow. And I think my clients are probably tired of me using this example, but I find that it says what needs to be said. When you're getting married, nobody says, I'm just going to let manjaras give me whatever they want. Whatever's in their kitchen for that day, bring it to the wedding. Okay, the interior decorator has pink drapes. I'm going with
That's
the flow.
convenient,
It's
yeah.
convenient. So when it comes to this huge, important event of your life, why are we going with the flow?
Right.
Why
So
are we-
have some ideas, have
Yes.
some goals.
Have some,
But be flexible.
Flexible. Don't
Yeah.
be hard set. Don't set things in stone. But know what to expect and know what you can do to be proactive during this process.
Right. And the other part is, we always leave dads out, so I'm trying to bring them in. The term, is it sympathetic pregnancy?
Yes.
Right.
Yeah.
Is that a real thing?
It is.
Right.
It is. I have dads who come, well, we do antenatal classes, and they'll be like, but you know what? She's not craving anything, but I am craving this, and that.
Okay.
And I'm growing. Look, my stomach's growing.
No, man.
Yeah, because they're eating so much.
Okay.
They're craving all of these things. There's no baby growing in. There's not a phantom pregnancy.
Okay.
But they're increasing calories.
So do they have the backache as well?
Some of them do.
Yeah.
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 It's not as common, but I do see it.
Okay.
It
Because I would think that the mirror neurons, when you're living with someone, when
Yes.
you observing someone, something happens within you that would
Yes,
mimic it.
Exactly.
So-
And the same thing, women that live together, they cycle synchronize.
Right.
It
Yeah.
happens.
Yeah, no, I know that. So everybody's moody in the home at the same time.
Yeah.
Yeah. So for dads out there is such a thing as sympathetic pregnancy.
Yes.
So we allow for some parts of it. But still the mum needs her back rubbed every night.
Oh, for sure.
Yeah.
Lower
No
back.
excuse, yeah. Okay. So, when you spoke about options and choices,
Mm-hmm.
and, when you watch the movies, you see the dads fainting. Is having a dad in the room a good idea? Is there even a choice to that?
Okay, so I have some clients who say clearly, I don't want him there.
Okay.
I don't want him there because he's squeamish, he stresses me out in these type of situations, and he's going to stress me out, and he's fine with not being there.
Okay.
Right?
Right.
So I currently have a client who says, I don't want him there.
Because I would think it would be the opposite way. I'd want this person there because we've been through this journey
Yes.
together, and the bonding that would happen
Yes.
would be immediate.
Yes. So it goes both ways.
It can
right?
go both
I
ways,
have
yeah.
moms who say, I don't want my mom there. Okay.
Okay.
But I need my husband to be there. Okay. Because pheromones, you know what your husband smells like? You in this
Yeah.
environment that we spoke of that's so clinical and sterile.
Yeah.
We have women pulling their husbands towards them during contractions because the pheromones comfort them. It's something that's familiar,
Okay.
right?
So if they don't bath, it's better?
I don't,
Sorry, I just had to put that in.
that's totally up to the mom and what type of pheromone she wants. And then we have moms who say, look, he stresses me out in these type of situations. If my kid falls and there's blood, he can't deal with it. And I know he's going to stress me out. And we've spoken about it. He's quite happy to sit outside and read Yasin and make dua and read Quran. But I don't want him there. And then dads are like, please, I don't want to be there. Either you call me in after the baby's born.
Okay, so as long as there's an understanding
as
between
consent.
partners,
Yes.
and the mum is not feeling isolated or abandoned,
Yeah.
then that seems to be okay. Whatever works for them.
Yes, and while we're speaking about pheromones, I have to mention that putting a hat onto your newborn baby disrupts bonding.
Really?
It disrupts bonding.
But they
tremendously.
actually, the hospitals keep the hats there, and
they
that's
do.
the first thing they put on,
Yeah.
other than the
Yeah.
blanket.
The only time I generally put a hat on for baby is we're doing Skintoskin in theatre. Because it's really cold.
Cold in theatre,
Yes,
yeah.
it's cold. So I put a hat on and then I keep warming up the blankets and the warmer and I keep changing
So
it.
you're saying the more skin to skin contact we have over a larger space,
Yes.
actually
But now
has an effect?
It does, definitely. So pheromones, every time a mom is holding a baby, she smells her baby's head.
Right.
And now we're blocking it off with a hat. That's affecting the pheromone. She can't, her olfactory system is now like,
Yeah,
I'm
because I've
supposed
read
to
somewhere that
bond.
even by smelling the baby,
Yes.
you would start the milk production would be affected.
And babies are attracted to the breast because of the smell,
Okay.
right? So they can't see much, but they can smell. The amniotic fluid has a smell, and it's familiar to them. And also the heartbeats on the mom's chest, and they've been listening to
Because
this heartbeat.
sound is the
Yes.
first sense to develop in
Absolutely.
babies, right?
So olfactory system is so important.
Okay.
Okay, so please,
Try
obviously
not
if
to
it's
put the hat
freezing
on,
now,
yeah.
put the hat on. But you're going to be disturbing the supply of your milk. You're going to disturb the bonding. A lot of moms with postnatal depression find that they haven't bonded with their babies. And we find that these moms have not had skin to skin post birth.
Right.
They have a hat on the baby because that's what the grandparents want, the hat on the baby. So you can't smell your baby. You can't get the pheromones. So you're not bonding in that way. She didn't have a supportive birth. She didn't. There's so much to consider, but it's very important not to mess with the pheromones.
Okay, and that sounds so amazing that you're so detailed in what you do, and so much is taken into account.
Yes.
It sounds like it's a very mindful process.
It is.
And a
is.
lot of that gets lost in the old way, the way things used to be done.
Yes.
Yeah. So
It
wow.
happens that way.
So what does an antenatal class entail? You have alluded to it that you do it with couples.
Yes.
I
Okay.
mean, I always thought antenatal was about breathing because it's about
Yes.
going through that motion.
Yes. Okay. So I do cover pain coping and breathing in depth, right? So I teach 5 different types of breathing that you use during labor and birth.
Okay. So
Okay.
breathing is the main tool.
It's very, very important.
So, I mean, I'm just assuming, they say that breathing is the remote control of the body. And if
yes.
someone's doing shallow breaths, they're probably going to feel pain more.
Yes.
So the 5 different techniques of breathing, that's...
There's way more,
Yeah.
but I teach 5 because I found these to be the most effective. And also, a lot of women, it's just a normal human reflex. When you're in pain, you want to
Hold your
tighten
breath.
everything,
Yeah.
right? And hold
Yeah.
your breath. And it's been found that tightening your jaw and your cervix are linked. So a tight jaw is a tight cervix, and we're trying to open up the cervix.
Okay.
Okay, so by breathing, a mom doesn't have a chance to really tighten. Of course, during some part of the process, she might tighten her body,
Yeah,
but
that's when you remind her, right,
You
yeah.
remind her that you're supposed to be breathing, and you remind her what type of breath to do. That is why it's important for dads to attend, because if you're not hiring the doula,
Yeah.
dads need to be reminding mom, this is what you're supposed to be doing.
Right. And I think practice.
Yes.
Because if you're practicing beforehand, then when it comes to this period, it
Yeah.
becomes a bit more natural
And
for you.
I'm glad that you mentioned it, because I do antenatal classes from 6 months, because the type of breathing that I teach you needs to be practiced. You can't do it in the class and then use it on the day of your birth.
Okay.
It has to be practiced, because we're basically tricking the mind
Right.
into we basically engaging the mind in a different way, as opposed to it concentrating on the pain.
Okay. So other than the deep breathing, also by, you biding time to get
Yes.
through that, that's what you call it?
Process.
Yeah, that
Yeah,
process.
yeah.
No, but I mean, the pain comes and goes. It's
It
like a
does.
wave.
Yes.
So if you're breathing through it, then you're distracting your mind away
Exactly.
from it, right?
And I always say also, one contraction at a time.
Contraction, that was the word I was looking
Don't
for.
look at
Yeah.
the clock. I find it's terrible that the clock's in front of a mom's face. Okay, because it actually should be behind her instead of being in front of her, because it's always on the wall in front. And the mom's like, I'm doing this for the last however many hours.
Okay.
Right.
So it adds more
It
pressure.
adds more pressure, because she's like, I'm in pain for so long,
Right.
and I'm only so many centimeters dilated, for
Okay.
example. Whereas if you're working one contraction at a time, okay, I've passed this contraction, I'm ready for the next. So it's about engaging the mind in a different way and making that mind shift.
Okay.
The mind's so powerful.
Yeah, definitely.
Yes.
Definitely.
So I do pain coping. We do a little bit of CPR and choking. We packing of your hospital bags. What's
Did
absolutely
you say
necessary.
choking?
Yes.
Okay, now what is choking?
So a lot of kids put things in their mouths, and they're blocking up their passages.
Okay.
So we teach moms and dads how to get that out,
Okay.
right? And then the CPR as well, because it's so easy, and it's literally a matter of life and death with simple techniques.
Okay.
And then we do your exercise. I give you safe exercises that you can do in pregnancy, and then show you how to engage your baby with these exercises from 6 months onwards.
So it
And
adds to the bonding experience.
It does,
Right.
right? And then there's so much more that I cover.
Right.
So much more. Breastfeeding is covered in depth.
Yeah.
in depth because a lot of moms go, okay, fine, they handed me the baby and they're like, oh, breastfeeding is so easy, it's so natural. It doesn't happen that way. For a lot of moms,
And I think that pressure of, it's natural, it'll just happen.
It's just going to happen. You're just going to bond with this baby. It doesn't happen that way. Especially if you've had a traumatic birth. A lot of moms find themselves bonding with their babies way later.
And even breastfeeding itself, I mean, it's quite a taxing process and can be painful. You can get engorged. That position, if you're not positioned correctly,
and
gives the pain, but also your back.
Yes.
You need to be well supported.
Exactly. Breastfeeding should never hurt. Okay. If your latch is sore, if you are cracked and bleeding, your latch is incorrect, number one, or your baby has a tongue tie or lip tie, and all of these things are addressed in a lactation consult. Okay, so you don't have to be feeding through pain.
Okay, so you don't have to suffer through it.
You don't have to suffer.
But that's it. Mums should be made aware of these things. That, if this is happening, check for that.
Yes.
Things like that. Because, where would you expect a first-time mum to get this information? And if you Google, my God, that's
no.
That'll increase anxiety.
Ooh, Google is bad. The reason that I became a doula is because when I had Samiha, there were so many things that I didn't know. And I'm a reader. I read so much.
Right.
And it was not easy, and I didn't know there was anyone to help me navigate this process.
Right.
So that is why I became a doula. I would ideally love to have been a midwife, but that was not an option with my kids.
Okay.
They're still little, right? So
not yet.
not yet. But yes, inshallah. The thing is, there is somebody to help you,
right.
And there are choices and options.
And I think we'll take that as our parting message.
Yes.
Thank you so much for joining us today and sharing so much of information. Just to round up for today, I would like to give a quick overview of how Islam views this time of pregnancy and the role of the mother. In the context of Islam, the birth of a child, girl or boy, is a very joyous event. All children are seen as gifts from Allah subhanahu wa ta'ala. In the Quran, childbirth and labor are recognized as extremely painful and a taxing experience. In the Quran, rendering the story of Bibi Maryam, the mother of Hazrat Isa alayhi salam, it quotes Bibi Maryam as saying, while in the throes of labor, would that I have died before this. Would that I had been a thing forgotten. The physical and emotional pain a mother endures during pregnancy, labor, delivery and postpartum is but one reason why Islam accords such an elevated status to mothers. In this regard, the Quran reminds people to respect the womb that bore you. Additionally, some of the traditions and saying of the Prophet in this regard include, the one owes to their mother 3 times more love and obedience than owed to one's father, and that paradise lies at the feet of one's mother due to this. Jazakallah once again for joining us in the show, and we will see you next week, inshallah. We will have another interesting topic and one that builds up from this topic, and that is postnatal depression. We will be speaking to Javi Mudli, a medical doctor who specializes in psychiatry, to discuss that topic. Assalamu alaikum, and I hope this show lived up to its promise to inspire, educate, and motivate. And remember, be mindful, be kind, and enjoy the rest of your week. Ma salam.